Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408 687 1899. My clinic address is 9701 Sarah N. Court, Dublin, California 94568. Anytime, at any age, when you are suffering from any disease and you are not getting progress in your treatment, you can call me to discuss your disease as well as your diagnosis and prognosis and also the treatment, so that I can guide you according to the natural principles, how the nature was curing diseases before the medical science was in existence. When there was no medical science, even then the persons were suffering from diseases, getting sick, and getting cured. There was a natural automatic process of this body, how it was getting sick and how it was getting cured. So, in this way, we have already studied from medical books and medical literatures, whatever is our history of medical science, that how at that time body was getting cured, how body was cured. So those things I can guide you, and so that you can find it out that where my progress has stopped, where I'm not getting well, what are the hurdles of it, so that I can guide you according to those principles, those things, so that you can take care of those things, and ultimately you can get well after taking care of all the principles, after running your life naturally. So, in this way, just 1 second. Yes. So, in this way, you can get well soon as it is possible. Because as soon as it is possible means, because there are certain time features for all the cells, all the tissues which are making this body. All the cells and the tissues have their specific time of repair, that how long it will take to repair if any type of tissue, any type of cells are getting damaged, and how long it takes to repair if it starts repair. If the repair has started, and now how long it will take to get well, to be repaired till that. So in this way, I can tell you that there are different type of tissues, different type of cells, which are making this whole body, and they have their own routine of repair, they have their own routine of recovery, and that recovery is also based on the metabolic rate of the body. So in this way, if there is no any other complication, yes, disease has come up because of the environmental things, because of the food type of things, because of the living behavior things have changed, and then a person can suffer from any disease. And when a person is suffering from any disease, he has a recovery until and unless his disease is complicated by some other resources, by some other complications, by some other type of functions, or that may be the causes of environments, that may be the causes of food, that may be the causes of our living styles, and sometimes after a long period, uh, we can run with any type of environment and any type of food materials, any type of living habits. But ultimately, at a certain distance, our body says hands are up. We cannot go with this type of environment. We cannot go with this type of food any longer, and we cannot maintain this type of life behavior. Suppose, for example, a person is night watching. And many a time I have explained in these lectures that there is a circadian system which runs according to the nature, light time and darkness time. So these two things are maintained by the nature on the universe. And our circadian system, which is guided by which is captured by, you can say, which is stimulated by or attached by with our pineal bodies. And this pineal body do not act according to your will. It acts according to the circadian system of the nature. And when you go against the principles of nature, ultimately, how long? Ultimately, if you go against the wind, you are cycling and you are going against the wind. Well, how long? You will tied up ultimately. And body will say, no, 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 we cannot go run this way. We have to go back towards the side of the wind. In this way, the circadian system is the natural system with which this body is guided, and guided by the pineal body, which is situated in the base of the brain, and that is guided by the dark area or the dark time at the day times, night times or at the day times. And it do not follow your instructions. Suppose if you are night watching and if you are doing night jobs, it's your will, you can go, but it does not suits to the natural process, and your body is you can say maintained a natural process, a natural way to run its life normally. And when you go against the natural principles, ultimately the body will say hands are up. No, I cannot go in this way. If you are continuously watching, night watching and doing night jobs, ultimately at a distance, the body will say no. There will be some type of complications which previously you do not recognize, because you say that I am running this life since many years. There is no problem. Now my life is set up like that. No, it's not. It's your force. It's your thinking that you are thinking that my life is now settled up like this one, that I wake up in the night and do job night watching, and ultimately daytime I'm sleeping. You can sleep any times. It is up to you. It depends upon the ratio of carbon dioxide and oxygen in your cells. When the carbon dioxide portion in the cells increases, you feel tired and you feel sleepy. And when there is a full of oxygen, you wake up in this way. And if even during the sleep your oxygen is not completed, under those conditions, even after wake up, you will feel tired. You do not feel fresh after the sleep in this way. So I just want to convey you this message, that there is a certain limits of everybody. They can bear stress, they can bear to go against the rules of the nature. In this way, if you are doing this thing, ultimately your body will tired. Will body gradually start dysfunctioning, ignoring the commands. You want to go job, but you are unable to perform your duties in a normal way which you are doing. So in this way, because body is based on the circadian system of the nature, and it is controlled. It is, you can say, a antenna. It's our antenna to capture the commands of the nature. And if you go against the command of the nature, ultimately, how long? Ultimately, you will tired. And if you tired, it does not mean that you tired mentally. No, all the systems are tired. All the systems will show up its behavior that no, we cannot run for a longer periods. So in this way, the same way, when you are passing through this type of a feature, this type of life phase, that every since long you are working the day night, I have explained many times. At the night time, you see all the household wives, what do they do? They clean up all the utensils of the day with the hot water, and then they clean it up, put it back, ultimately because they are to use it in the morning times. Clean utensils. In this way, when you go sleep, and according to the circadian system, nature in the midnight, anywhere where you are in the India, you are in America, you are in any other country, there is a midnight. According to the time sphere, there is a midnight. And at the time of midnight, nature performs a specific duty to exchange from one circadian circle to the other, from day to night, from night to day, from darkness to light, and from light to darkness. And if suppose you are still awake, it means you are not following the circadian system. What happens in circadian systems? If you follow that one at the darkness periods, you are relaxed. You sleep, and then ultimately all the muscles, all the body parts are in a relaxed phase. At that time, normally the procedure, I have told many times, the procedure is that oxygen is heavier. It goes by breathing into the lungs, and ultimately the carbon dioxide and other gases are lighter. They go out. But in the middle of the night, this cycle is totally reversed because the circadian system has started. They are passing with the circadian systems, darkness systems. And that darkness system, if you are relaxing, if you are sleeping, definitely one time this system will change, and ultimately the warmness of the gases and all that will clean up your lungs. And ultimately when you are sleeping and clean up your lungs, then at that condition lungs are cleaned. Not only the lungs, but our other organs are also working according to the circadian system, because you are following that rule, which is guided by the pineal body, third eye, you can say it, third eye. In this way ultimately, the after this course is complete and there is a daylight, circadian system is changing, darkness period is going, and daylight, ultimately it will be filled with excess of oxygen, because all the alveoli of the lungs are are dilated maximum with the gas. They are dilated maximum with the gas, and as the daylight comes and oxygen enters into it in a maximum, because all the utensils are totally complete, clean, empty, it can fill up more substance. In this way, if you follow the circadian system for your work, for your sleep, for your all workings, means you are following the nature. And if you are not following these rules, ultimately the lungs gradually they will remain filled with the toxic type of gases, and there will not be a more room for the oxygen to go. Ultimately, you will start feeling tiredness. Even after sleeping, you will feel tiredness. Do not feel good after awaking, because you are awaking at the night time and you are not following the nature's. Oxygen is not fed. Our lives is based on the oxygen, and you are not having sufficient, maximum sufficient oxygen in your lungs, which the lungs are to supply to the whole body. It means every cell, every part of the body will be having a deficiency of the oxygen. And there is a deficiency of the oxygen means you are feeling tired. Means every cell is not performing their duty at a sufficient peak level. They are low. And how long? Ultimately, if this process goes on, ultimately the strength and capacity of working of each and every cell will be declined, reduced. And this will happen normally after few years, depending upon individual strength, depending upon individual capacity. And then after that, early than the normal persons, early than the normal person who are following the circadian system, they will fall sick. Regularly, they will start falling sick, and all the things will increase. Here, this is only one thing. I guided you. First of all, when you are getting sick regularly, you have to follow and you have to investigate the things. What things are causing my sickness? And first thing we inquire about whether you are following the circadian system or not. Suppose if you are not following the circadian system, even if you are taking healthy diet, it will not work, because all the systems are not capable of working, capable of getting maximum nutrients out of that diet. It means even taking healthy, you might have listened from many persons that even after taking healthy diet, I'm still weak. I'm still not getting energy and all that. Why? They do not know about this one because they are not following the routine of circadian system. You should. Everybody should. And if really you are following, suppose if at midnight before 10 a.m., 10 p.m. till 2 p.m., in the midnight periods of 2 hours early and 2 hours late from the midnight, if you are sleeping completely, this process will done by the nature, and the maximum oxygen is filled. And when you wake up, even after 4 hours of sleep, if you wake up, you have sufficient energy to work for the remaining 20 hours. But if at that time you are awaking, means you are not following the circadian rules, and body is not getting maximum sufficient oxygen to provide to all the cells so that all the cells are energetic, then ultimately they will tired. Ultimately they will say hands are up. The whole system will say hands are up. Then what? All the trivial ailments will come up. Easily suffering from flu, easily suffering from fever, easily suffering from pains, this and that. But you do not know about that one, that what mistake I am doing. What are the reasons behind that one? So, in this way, my first rule, which I want to convey as per the nature's rule, is follow the circadian system in your life. Nothing will go with you when you die. When you go from, because that's a fact, that's a fact, and that has to. So nothing will go with you when you go from this earth, when you go from this life. For what? You are exerting more, you are exerting unnecessarily, you are not following the circadian system and waking at night and working more hours for what? To keep up your responsibilities. Yes, sometimes we need to, because we think that we have some responsibilities and we have to fulfill those responsibilities. And to fulfill those responsibilities, sometimes you need to work hard, but please keep up, follow up the circadian systems, which is nature's principles. If you want to get rid of all the ailments, trivial ailments, and you want to remain healthy, and even if fall sick, you will recover soon. You will recover. Even during the sickness, you might have seen that. Even during sickness at night, if you take a deep sleep at the night time, you will have a fast recovery of your disease as compared to the others which are not following the circadian systems. In this way, my recommendation for all of you is to follow the circadian system in general. And when you fall sick, specifically, you have to follow this rule. You should take a deep sleep. And when you take a deep sleep at night time, not at a daytime, daytime is a different thing. Daytime is that you are getting old and the energy, whatever the oxygen has gone into the cells, is not sufficient for work 24 hours. It's not. In that way, we become tired easily. And the old persons, they need snap. They want to take a nap even during the day. There's a different story to fill up the oxygen. Just like we are working and pulling on cart, and ultimately to take a break. When you take a break, ultimately that's process of the body takes maximum oxygen which has been already consumed. That's why you feel tired. And when you take a nap, the daytimes, that oxygen is filled which has been already consumed, and that filled, and then again you are capable, because your capacity, the storage capacity, is less. As per the old persons, your storage capacity of the oxygen is less, and it is the basis of our life. That is why the old people need to take a nap the daytimes. But I'm talking about whenever you are relaxed, more oxygen can go inside. But I'm talking in a routine, that if you follow the circadian system, it doesn't mean that the old persons, if they are taking a nap and they can awake at night and they will not fall sick. No, they will, because circadian system is different from your nap. It has its own rule. And all the creators, all the creations, plants even, not only the animals and human beings and all that, plants even follow these rules. Sometime you might have heard, it's the dopar khedi, which goes with the sun's rays. They dilate their everything so that it can capture more oxygen after that. There is a routine for that one. The same way, our body is designed in this way, that at night, basically at midnight, you should have a deep sleep so that you can wake up fresh and you will be having a more capability to work. Ultimately, if you're working at night, that capacity of working is reduced time to time, and the same work which you are working at a young age, will you are not able to work after a few years. Even still, you are not old person. You are not still old person, but you are not following the circadian system. Under those conditions, you will become tired. Healthy young person will become tired, will feel tired at a distance, when since a long period he is not following the circadian system. He is not sleeping at night, he is sleeping daytime, He's doing job, but ultimately all the persons who are doing the jobs, now we are using the body like a machine. Machine is not having any tiredness. It's the human body, living cells, which we consider the living cells. So all these living cells are following the circadian system of the nature. Even the earthworm, even the plants, all the animals, they are following this one. And in this way our body should follow the circadian system and should get full sleep at night. And if you are not sleeping at night, midnight, your body is not relaxed and your lungs are not relaxed. In other words, I can say the lungs are not relaxed and you are not getting cleaned up inside by the other carbon dioxide and other gases. And if it is not cleaned up, ultimately it will not having a sufficient quantity to put the oxygen in. So in this way, to give maximum oxygen to your body, their alveoli of the lungs are those utensils which carry the oxygen, which are having the capacity to carry maximum oxygen, and it is only based on the circadian system. So please follow first of all this circadian system. If you are not getting well even after being sick, follow the circadian system and you will see the results with that one, that you are getting well soon as compared to the other people who are not following the circadian system. Why you take a leave? Why we are bound to take a leave from job when we're falling sick? Because you take rest. When you take rest, more carbon dioxide and other gases are released from the body. Really, if you take rest, then all the utensils, means the alveoli of the lungs, all the utensils are cleaned sufficiently. There is nothing inside, and more oxygen can go inside, which will give you more energy, which will you can use that oxygen to supply by the heart, you to supply to the all tissues. Every cell will get more oxygen, and every cell will be energetic because you take rest from the jobs. Even daytime jobs also, sometimes people fall sick and they have a sick leave. And sick leave means that you are preparing your body to follow the natural rule to take a rest, so that the body is relaxed. When the body is relaxed, it is capable of acquiring, of lodging more oxygen as compared to the exercise. When you are actively working at that time you are unable to take more oxygen. That's why, because more oxygen is used. Why your breathings are hurried when you are exercising, when you are working? In spite of 14 to 16 times per minute, you are breathing more times. Why? Because during the exercise or during working periods, you need more exercise, more oxygens, and more oxygen is not coming because the alveoli are already filled with that one. So that carbon dioxide, unless it goes out completely, and then it can have more oxygen in it, and then you will sometimes few peoples, when they are exercising, they do not feel breathlessness. But some of the peoples running this parallel exercise, they have hard breathing, they have breathlessness, and they are unable to run for a longer periods. Why? Because the lungs are not having sufficient oxygen capacity, which is coming from the nose inside, to supply to the cells, and the demand of the cell has increased because of the exercise. Demand of the cell has increased because of the exercise, and there is a limited quota of the oxygen in the lungs. So to increase limit quota of the lung for the oxygen, you need to relax. And when you need to relax, all the pouches of alveoli are releasing. There is a easiness easy that all the carbon dioxide, all the nitrogenous gases which are collected from the body will go out, and it will make a space for maximum oxygen to enter into the lungs. If it is already filled up, no other thing will come up, definitely. So in this way, the first rule to get healthy, first rule to remain healthy is to follow the circadian system. And even if you are healthy, you follow that one, you will not fall sick easily. If you are sick and if you follow the circadian system, all the medicine will work and your body will automatically recover because it's a self-receptive body. It self cures himself because of the circadian system. And but what's going on today? We are trying this body to cure forcibly by the action of medicines. What aspirin is doing, what other vasodilator medicines are doing, they are trying to dilate the cells so that they can take maximum oxygen forcibly. But when you are not taking that medications, you are addicted to, you are bound to take that one because that was helping you to dilate the organs to get more oxygen and you feel well. When you stop the medicine, why you feel weakness? Any medicine you are taking for the cure of the disease, when you stop those medications, ultimately you feel weak because there are two type of functions of each medicine, whatever medicines you are taking: vasoconstrictor and vasodilator. And vasodilator, and during sickness, medicines are used mostly for the vasodilator functions, so that maximum oxygen can come in and it can cure itself. It can take part in the recovery of the sickness. But when you stop those medications, because you are making artificial arrangement for the vasodilators, you are making artificial arrangements for the vasodilators, so that by artificial means you can take more oxygen in and ultimately you are recovering. And but after that, when you will stop those medications, definitely you will feel weakness because now sufficient oxygen is not going in. And the formula for a routine sufficient oxygen intake is carried out if you follow the rule of the nature, that is the circadian system. Second thing is concerned with the environment. At this time, we feel that our environment has been polluted and we are bound to live in this environment. The first thing, a relation. Uh, Guru Nanak says, "Jo kich paya so ekavar." Whatever the nature has done, it's one time, and that is going on with the exchange. The second thing he said, "Amol gun, amol vyapar, amol vyapariya, amol pandar." Never ending storage. There is a big storage because everything is going give and take. Sometimes, simple example, we throw out garbage, but there's nothing garbage. Our garbage is useful for some other species, for other type of animals, creatures of the nature, and their garbage is useful for us, just like the honey. It's extra wastage of the honeybee, and it is good for us. The same thing, our wastage of the body is also useful for some of the creations. In this way, nothing is wasted. It depends what is useful for the others, what is useful for us. And As per the environment is concerned, what is useful for us? Again, the oxygen, again, the healthy foods, again, the natural products, natural fruits, natural vegetables, natural everything. But what happened nowadays? We are bound to live in that era. This era is a polluted era, you can say that one, because all the crops are grown by fertilizers. All the crops are grown saved by pesticides, and these pesticides and fertilizers are a part of that fruit, part of that food, part of those vegetables we are growing with these things, and ultimately we are bound to use that one. We are bound to use those things, and with normal contents of the food, with normal content of the vegetables, we are also ingesting the fertilizers and pesticides in our body, and ultimately their percentage rises inside the body, and their person rises inside the body. And what they do, just like they grow the fruits, they grow the vegetables, they grow the crops very fast. In spite of 120 days, the crops are growing in 90 days, and even less than that, sati makki, like that one. So we are growing the vegetables and foodstuffs, whatever we are eating, in a very fast way. And these fruits, these food contents are concentrated with fertilizers and pesticides. What they do? The same thing they do with our cells. When they go inside our body, they do the same things. And we are becoming old very fast. Fast we are becoming old. Fast our system is declining and saying hands are up. Indigestions, breathlessness, heart problems, kidney problems, all these things are the result of that our food is concentrated with fertilizer and pesticides, and they are having a more than a normal concentration inside our body. And what they are doing outside with the crops, the same thing they are growing with our body. When they are doing the same thing with our body, easily the life expectancy of our cell is 120 days. And suppose if a crop we grow, which should grow up and ripen within 120 days, and we are ripening it within 90 days, definitely the same thing will happen to our cells. We will grow old. Life expectancy will slow down, and it will be less than the normal things. In this way, my second recommendation for all of you is that you should try. Why nowadays all the food stores and vegetable stores, they are having natural, without fertilizer. Why they label all these things? Because they are trying to convince you that we have not used any pesticide or fertilizers for growing these things. But still, the environments, Prague cases, that is from the other plants, is used thereby. Suppose a mother has to born a child. He needs the help of a man. A female needs the help of a man. A ovum if wants to grow as a child, as a fetus, needs the help of a sperm genetically. In this way, you cannot avoid the mixing of all the environmental things in your crops, even if openly you see it's safe, organic. You say it's organic, or but still in the organic things, because you cannot avoid the environment. Easy example I can give you. Suppose you are not using any pesticide or any fertilized in your crops, but there is a heavy rain. There is a heavy rain, and the water from the one field goes to the other fields, and that field has already used the pesticide and all those things. Then how you can avoid that one? The same thing, the environmental thing, you cannot avoid those things. It's not just like a magnetic field. You know all of those. What's the magnetic field? The power of magnet is having a circle around it, from where it can attract the iron particles. The same way our environment has impact on the environment, and you can say that it is mixed up. It is mixed up, and in that area, whether or not you are using any pesticide or not, your all crops are having the impact or impression of those pesticides. One more example, very easy example. You know, everybody knows about the Hiroshima, Nagasaki, when the hydrogen bombs were blast over there. And still, after so many decades, they are not having normal children born over there. They are not having the normal crops being ripened over there. And what do you think? If you are using the crops ripened by the pesticide and fertilized, are you taking organic things? No, not at all. We are living in this era. It is very impossible, not only impossible, it's very impossible to claim that our food is free of pesticides and fertilized. Even then, as far as possible, we should try to avoid those kind of things. We should try to avoid those kind of things which are grown up by the pesticides and fertilized. In this way, if you can avoid this type of things, definitely you are saving some portions. You are helping your body to grow normal by this action, that you are not using the more pesticides directly to your crop. Whatever you are eating, suppose for your own home, homegrown vegetables and homegrown crops and all that, if you can use that, or if you can manage that a specific field for that one, definitely you are good as compared to the others, because all other foodstuffs are grown up with the fertilizer and pesticides, and they are having their concentration in it, and you are eating that one, or those who are you eating those one, definitely having their concentration in their cells. And these pesticides and fertilizers will do the same thing but the Hiroshima, Nagasaki, the bombs has done over there. Anywhere, if these kind of bombs are blast, definitely you will see the similar type of results. The same way we are using the pesticide and fertilizer for our crops to grow more than their normal periods, ultimately they are concentrated in your crops. So this is the second thing I can advise to all those, that whenever you fall sick, you please try to avoid those things which are grown up in an other way in the marketing style. Try to use your own stuffs, grown up own, without any fertilizer and pesticides, and you will see the results. You will get well soon. You will get. You might have heard from the YouTube and many other times the greens, wheat greens. They grow wheat greens, and when it grow up, then they make juices for that one, and it is good for cancerous cases. And cancer is the worst type of cell change which ultimately cause death. And it has been verified by the experiments that these wheat greens, if you convert it into juice, when the wheat green grows up, ultimately you take that wheat green, make a juice of it one, and most of the people are taking, and they are giving very good results for that. This is one example I can give you. That try to use foodstuffs, whatever is vegetables or crops and all that one, try to use these type of things which are grown up without fertilizer and pesticides. It will save your life. It will save your lives, and you will decrease in concentration of these type of toxic substances from body. But the folly is that nowadays, everybody, I think maximum peoples are addicted of taking one or the other medications. Most of the, suppose if there are 5 members in the families, at least three family members are taking some or other kind of medications. So what's going on? They are taking that kind of fertilizer or pesticides by means of medication in their body, and ultimately they become addicted to that one. So in this way, it's not only that food you can avoid, and not that for vegetables and all those things you can avoid, even ultimately you should avoid maximum medications, because nowadays the market has developed all over that they are trying to convince the public to use maximum medications for that one. I can give you one example, though it goes again against the medical science. And I can remember one thing. When I was a medical student, every year I was writing a story, and it was played, stage play, and it was played every year on Saraswati Puja, the year's festivals. And ultimately, in 1973, the last year of my medical school at that time, I wrote a story for this medical malpractice at that times. That what's going on? Peoples are having relations with the laboratories. Peoples are having relations with the X-rays and all other things. Peoples are having doctors are having agents to bring the customers with them, and they are paying commission to them. Everywhere there was commission going on. This was the folly. And when this play was played in Sinha Homeopathic Medical College in 73, Saraswati Pujas, a wonder rises up in Darbhanga and Lahiri Asrai. This is joint city, Lahiri Asrai and Darbhanga, and they were all against me. Why you played this thing? Why you open all these things? And this is what going on. This is what going on. And I can give you one example again. First of all, nature's process. Nature's process is regarding the blood pressures, because tons of blood pressure is going, coming in the blood vessels. And in this way, the normal blood pressure, every vessel, when it is used, ultimately the elasticity declines. That's the old age. Every blood vessel declines its elasticity, and that is known as old age. And the normal criteria, which has been resulted from the physiological point of view, that a normal person has blood pressure, systolic pressure, because there are two blood pressures, systolic pressure and diastolic pressure. The systolic pressure should be maximum 100 plus age. That formula has been invented by the physiologists. 100 plus age. Suppose my age is 76 and my maximum blood pressure is 100 plus is 176. But ultimately, if you will run fast at your maximum capacity, definitely you will tired easy. So what they resulted in? They resulted, oh, just slow down, yaar. Slow down, not 176. Come down at least about 30 or 40. And if you come down 30, it will be 146. It means persons like me, if he is having blood pressure 146, systolic pressure, it's normal. Under 50, under 150, it's normal. And about the diastolic pressure, according to the physiologist, is for less from diastolic pressure, it should be less than 40 number less. Means if my blood pressure is suppose 150 systolic pressure, it should be 110. But what has been considered it? The maximum limit we consider for the diastolic pressure is 90. If we consider it 90, add 40 to this one, 130. But what's going on in the world, in the medical words? They are decreasing this limit from 30, 40 to 120. Every doctor will say, no, 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 the blood pressure, if it's high more than 120 by 80, is extra. Because the difference between 180 and 120 and 80 is 40. And they said, no, 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 it's high if it goes beyond that limit. But nowadays, again, the marketing companies, medicine making companies, they are setting up or pressurizing the doctor to bring it more down. No, now they say no, blood pressure should be 110 over 100. This is 70. Okay, 110 over 70. Why? Because they want to make more patients. They want all the communities. They want to bring in this thing that everybody should take medications. The same thing was the sugar, diabetes. They are making more patients for that one. They are making more patients. They are declining the range of sugar levels. Normally, 80 milligrams of 100 ml of blood, 80 milligram of sugar in 100 ml of blood is considered to be a healthy sugar for a boy, for a young person. And ultimately, you grow old, and you have, just like the old people have constipation. And in this way, everybody, when it is growing old, means the concentration of the sugar will remain more inside the cells. In spite of 80 milligrams per 100 ml of blood, it will be more than that. And if it goes more, oh, they have designed the tests in this way that, oh, your A1C is this one. No, 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 it's high. If it goes about 5.7 A1C, no, 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 it's high. But the normal range also changed according to the age factor. According to the age of the persons, it changes. And if you do not obey that one, you are forcibly trying to use the medications on the advocacy of those medicine making companies, and they are pressurizing the doctors, and doctors are explaining the same thing. Oh, no, 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 your sugar level should be more than less than this one, less than this one. And even suppose at my age, if the sugar level is 140 and I feel healthy, because the main standard of life, when you fall sick, when you say I'm sick, when you say I'm sick, when there is some change which is more than normal, than your feeling, than your body adjustment is. And if your body is adjusted at the 140 sugar level, then you are not abnormal. But they say no, it should be under 120. under that level, and the A1C should be 5.6. They are bound to bring at that level. But no, always not. It's not true always. So in this way, first of all, the first point we discussed about the circadian system. Second point we have discussed, if you want to remain healthy. Second point, I discussed about the foodstuffs. Our foodstuffs are nowadays concentrated with the chemicals, and chemicals are growing our cells very fast to their old age. In spite of 120 days for one cell, they are dying more fast, and we are getting old more fast as compared to the normal. And who plays that role? Fertilizers plus the medicines, because everybody is taking medication for one or the other cause. Everybody, if body says I'm not sick, why you are taking the medication? Because we are depending on the lab test, and the lab tests are designed by the doctors, and the doctors are guided by the pharmacists, and pharmacists are bounded to say whatever the companies says. A chain a chain has become up and forcing us to use what they want us to use, though it's harmful to us. And now it is industry, medicine industry, why it's growing day by day, because they are forcing us to lower down the standards of medical health. We have made some standard of health. Okay, so standard of health, just like we just talk about that, blood pressure, we talk about the sugar levels, we talk about the cholesterol and all that. But they are nowadays, they are intending to lower down all these scales, so that they can make every person, even the born child are suffering from the diabetes, A type diabetes, when the pancreas is not producing the insulin properly, or even there is a sensitivity which is not created for the insulin. That is the function of the liver that has been damaged. That's a long story. I will explain someday later on. But this is what going on in the medical science, in the medicinal field, that we are forced to use the medications, maximum medications, and we are not allowing our body to work according to its own rule, not by nature. Circadian system we are not following, not by natural process of our food. We are forced to use those things which are not good for us, which are deteriorating our health time to time, and we are bound to. As I told, the last words, as I told, medicines have two types of functions. Whatever medicine is, Ayurvedic, homeopathic, allopathic, what medicines are having two type of functions. One is vasodilator. The other one is vasoconstrictor, wherever it is required. The most of the medicines are used for vasodilation, so that they can adjust maximum stuffs coming from outside inside the body. And when you stop that one, ultimately we feel weak and we become addicted. So this is what going on in the medical practice. The one thing still remains. We will discuss it later in the next, because my time is over now. We have discussed the circadian system, the natural process to get healthy, to follow the circadian system. We have discussed about the food materials, okay, environments and food materials. So we will continue with this lecture, but we are at the phase of discussing systematically about the organs of the mediastinum, because we were discussing the organs of the mediastinum, and we were at the chapter of lungs, and we are describing the lungs, and this is also related with the lung chapter. that I should explain this circadian system, how it is affecting our lungs or oxygen carrying capacity. So, today my time is over. This is Gurdeep Singh Sandhu, your homeopathic consultant. My phone number is 408-687-1899. My email address is 97 homeomedicine at yahoo.com. Address is 9701 Sarah and Court, Dublin, California. If ever any time you are suffering from any disease and you want to take a second opinion of the disease, you can call me at 408-687-1899. And if you want to get treated by a systematic approach of homeopathic, because the homeopathic follows the instructions of the body, what the body wants to do. Suppose, before closing this one, I want to give you this example. A person feels nausea, vomiting. He wants to vomit that one. What it indicates? Body indicates that something has gone inside the body which is not acceptable. And body wants to vomit it out. But what you do? What the doctors are doing? They are trying to give you the medications which will stop the medication, which will stop the vomiting. And ultimately, you feel uneasiness after taking that medication, and sometimes it is injuries which you cannot see what damages it is causing inside your system. And ultimately, if something is more wrong inside the body, more wrong things have gone inside the body, and it is continuously going inside the body, just like the endotoxins, and then you will have diarrhea. And then you will go to the doctor, and they will not think that you have stopped the vomiting, and that is you are having the diarrhea because of that one. No, they will not correlate this thing. No, they will give the medicines for the diarrhea, and then you will stop the diarrhea, and ultimately again nauseatic tendency and all these things will grow up. And if not, it will be concentrated inside your system and will damage your system from inside. And ultimately the endotoxin, disease producing toxic substances which are produced inside the body, are known as endotoxins. And disease producing agents which are entering from outside inside the body, are the exotoxins. So in this way, we should follow the rules, what the nature wants to do, what the body demands. So we should follow the rule and we should do the same thing. And that is the homeopathic law. That's the homeopathic principles. What the nature wants to give. Suppose nature wants to vomit. We give the medicines which will promote vomiting. And ultimately, that toxic substances which has entered inside the body will come out. And you will feel a permanent relief. It's not only with the vomiting. This is one example. This is with all type of diseases. And in all type of diseases, our body give indications, expressions outside. This is what I'm giving in these lectures regularly, every day. For certain diseases, what will be the outwardly indications? For this thing, for this disease, what will be the outward expressions of the disease, and what body wants us to do? So all these things we are giving systematically in these lectures. And if you think that these lectures are beneficial for the humanity, please convey this message to your nearest and dearest, so that they can join my Facebook friendship, they can join my YouTube channels, or they can join Sabarang radio stations. These programs are relayed at 5 to 6 live at California Pacific times. And after that, you can listen it on YouTube for a longer periods. Even when I will not be here at this earth, these lectures will remain inside the YouTube. But personally, presently, you can listen all these programs. You can see me on Facebook media, and that remains for a longer period, even up to a month, on the Facebook media. So, Rabarakha, God bless you all. Uh, and we'll see you tomorrow. And tomorrow is Hindi lectures. All these things which I have explained today will explain in Hindi, so that those people who cannot understand the English lectures, they can understand in Hindi, and after that they can understand in Punjabi. So all the lectures I'm repeating in all three languages on different days. Every day, one language. so that everybody who knows about Punjabi, who knows Hindi, who knows English, they can understand what I want to convey to you. Thank you. Thank you for listening. Rab Rakha. God bless you all.